Sneha, audio?
Yes.
Dr. Sneha, we can't hear anything. If you can talk or...
Ma'am, the audio is not heard.
No.
Yeah.
मैम शेयरिंग कर रहे हैं, जब वहाँ पे शेयरिंग द कंप्यूटर ऑडियो में सिलेक्ट करना पड़ता है.
Still not audible, Sneha.
So this is a
You can
case.
speak up.
The 20-year-old female presented to us post LASIK surgery, and she complained of blurred vision due to loss of flap or a button hole. Her uncorrected visual acuity was 6/60 and best corrected was 6/80 with -2.5 cylinder and 135 degrees. So we decided to treat her. These were the options available to us. The first one was PTK. It would result in larger area of ablation, excessive tissue ablation, and hyperopic shift. The second one was femtosecond assisted anterior lamellar keratotomy. So we wanted to see for some other options to customize the treatment. We did a literature search and we saw this article of topography-based removal of corneal epithelium in keratoconus, where decentered pores were treated by localizing the area and the depth of ablation. So on the Schwinn platform, we identified the cone, measured their dimensions, dynamic cyclotorsion was taken into account, and then topo-guided PTK of 20 microns was done over the thinnest area of epithelium. First, then the manual epithelium was removed, and this was followed by collagen cross-linking with a 0.1% riboflavin for 20 minutes, followed by UV radiation. So we decided to apply a similar technique here. We measured the depth. It was on anterior segment OCT. It was 145 microns. Then we went on to the PTK cam mode. The horizontal and the vertical dimensions of the scar were measured. Following that, we planned that we could tilt the axis of ablation and we could customize the ablation according to the scar. This is the decentered ablation profile on the software of Schwinn, PTK cam software. The scar was delineated, the cyclotorsion was taken into account, and we customized the treatment according to the dimensions with minimal collateral damage. The depth was kept to be 75 microns, which prevented the over-ablation and excessive hyperopic shift. The post-operative outcome was good.
Go ahead, finish it. Yeah.
So this has opened up a new dimension for customized treatment. Can be treated in following conditions. In post-PRK haze, in recurrent corneal erosions, post-viral keratitis, band-shaped keratopathy, corneal dystrophies, the superficial ones. Thank you.
Excellent presentation, Dr. Sneha.
Thank you, sir.
I think, I have seen many of these type of scars when there is some complication with the, blade LASIK surgery gone wrong. There is a buttonhole, as you rightly mentioned, especially in the Steve's cornea, or if we are reusing the blades. So the take-home message is do not reuse the blades. And if you have this scar management, I think what you show is, the software is only available for the Schwinn. Is there any way, if we don't have the Schwinn machine, and we can do on any other machine like this? Any idea? Or what would be the mode of treating?
I will want to, like, recently we got MEL 90, Dr. Mohak. So I want to ask you, like, they showed that there is a PTK mode where you can go from 2 millimeters to 8 millimeters. So I wanted to, actually that time I wanted to discuss, but then I thought today would be a good time, whether we can do that or not in Zeiss, because if it's a 2 millimeter zone to 8 millimeter zone, then you can probably customize the treatment with Zeiss. That is what I was. Only thing is, you have, like, the decentration has to be thought about.
Yes, I think Zeiss does this pupil tracking. So I am not very actually sure that this much of decentration would be possible with the Zeiss MEL 90. I think, but what we can do, we can turn up the eye tracker, and then definitely, we can ask the patient not to move the eyes and the head. So we should have some control. I think it is possible. I have a couple of patients lined up, and I think you can also do it and let us know what happens.
Yeah,
So
because yesterday only I saw
track.
this feature of MEL 90, so I wanted to ask you.
Yeah, so far I have not treated anyone. Dr. Alisha, your views?
I think it's a fabulous idea. This patient would have, the best treatment possible would have been a FALC. And here with this, now with the RGP, this patient is going to have excellent vision. Maybe even without an RGP, his vision is going to be good. So I think this is a fabulous thing. And I wish that all the other LASIK platforms now have this topo guided and this thing where we can customize our ablations. So even with mild keratoconus, we don't have access to a Schwind. So it's difficult for us to do these decentered ablations. But
I think Ahmedabad should get one Schwind now.
I think Ahmedabad needs one, Schwind.
You and Mohak can decide.
But I think
excellent. I'm gonna give a try with the Zeiss MEL 90 first.
Yeah.
I think, if I'm not wrong, you have done this on some keratoconus patients as well, Dr. Puja, right? I think you and Dr.
Yeah. So I think Dr. Ritika will present that as well for keratoconic eyes, and we recently published it as well. We have a 2-year data which shows it's stable. So that is why I was interested, because if MEL 90 can also do it, then it would broaden the horizons of this treatment. And track, like this procedure, what she showed, customized PTK, is nothing extraordinary. There you don't need to think what will happen, refractive surprise and all that. There you're just regularizing the cornea. So I think if other machines can do it, that would be the best way forward.
Dr. Shruti, do you have any experience with your machine? I think you have Boston and Lomb, right? Is Dr. Shruti there? Yeah.
Hello. Yeah, am I audible?
We can hear you. Yes, please.
Yeah. Sorry, I joined in late. So can you repeat, Dr. Mohak, please?
Yeah. What Dr. Sneha showed was a scar management using the track one. It is basically a PTK, but the customized decentered PTK. So do you have any experience on your Boston and Lomb machine? Is there any software like that, or you have done any other way?
No, the Bosch & Lomb machine doesn't have that software to customize the PTK. You have to use the zone, and probably you can little bit decenter on the area and focus on that area and fire. But it doesn't have the customized software inbuilt. Probably they should inbuilt now.
Okay. I think that's a take-home message for every other, exam laser platform should have this software. I'll let you know regarding the Zeiss one.